Hello, welcome to another episode of Fridays with Fawn. I'm Fawn Lopez, publisher of Modern Healthcare and Vice President at Crane Communications. Joining us today is Pam Kehaly, President and CEO of Blue Cross Blue Shield of Arizona. Pam, thank you for joining me. It is a pleasure to have you as our guest on this episode of Fridays with Fawn.
I so appreciate being here, and so nice to be hanging out with you, Fawn.
Thank you. All right, let's get started. You've worked in the insurance industry for over 30 years in roles that included operations and financial management in several different Blue Cross, Blue Shield, and Anthem organizations. How do you feel this positioned you for success as the president and CEO of Blue Cross Blue Shield of Arizona?
Well, first of all, when you say 30 years, I've changed how I respond to how long have you been in the industry. I just say decades now, because 30 years, decades sounds long too, but 30 years sounds really long. But I have been in the health insurance industry for 30 years and have been blessed to work in a huge variety of different roles and areas. And that has allowed me to learn about how health insurance operates. I actually, because I've been in so many different roles over such a long period of time, I know how work gets done in an insurance company. And that's a really important aspect of leadership. You don't have to micromanage and know every detail, but you have to know how work gets done. And by having all of these different roles, I have the opportunity to learn that. I also have had the really incredibly good fortune of working with amazing leaders over my career, and literally legends. I've had the chance to work directly with Leonard Schaefer, who was with WellPoint, with Ron Williams, who was with WellPoint and Aetna, and having the opportunity to really observe and learn from those types of incredibly strong leaders is something I'm incredibly grateful for. And I use what I've learned from leaders along the way every single day in my work. And so this combination of lots of different roles and really good leaders, I think has been a huge benefit for me and helping me be successful in my current role.
Absolutely. Both Leonard and Ron are, you're right, giants.
Giants.
Yes. So you and Blue Cross Blue Shield of Arizona have received accolades and honors since you assumed your role in 2017. What do you consider your greatest accomplishment of the last 5 years?
Well, the one thing I'm really proud of, not my accomplishment, but I'm so proud of the team, the people that work at Blue Cross Blue Shield of Arizona, because they are so willing to engage not only with our customers, but the entire community in this really empathetic, passionate, caring way. And that, when you've got that kind of foundation, that enables me to go out and do pretty incredible things on behalf of the company. One of the things that, when I look back, it's been 4 years since I've been in Arizona. One of the things that really stands out as something that I'm incredibly proud of on behalf of the company was when we were asked by the state of Arizona to help run the first mass COVID vaccination site in the nation. And it was even virtually visited by President Biden and Vice President Harris. It was quite incredible. But we mobilized all these amazing employees that have this passion for the community and for people. We mobilized our families, the community, and we delivered 145,000 volunteer hours and delivered almost 500,000 COVID vaccines from like January to April of last year. And it was an extraordinary experience and something I will always be really proud of. My husband and I spent a lot of time working at the site ourselves. And it was, in fact, it was hard to find volunteers at night. It was a 24/7 site. So there was no downtime. It was harder to find volunteers to work at night. And so my husband would go work the night shifts.
Wow.
And I would be there during the day. So we had a couple months where we hardly saw each other, but it was just such a humbling experience to be a part of an opportunity that really, really saved lives in Arizona. So I think that's probably something I'll always look back on and be really, really proud of.
Well, we're grateful for what you've done, and thank you to you and your husband for the work. And that's amazing. And again, we're grateful.
Thank you, Fawn.
So success in your role requires collaboration with so many stakeholders, including physicians, hospitals, policymakers, and local leaders, governmental leaders. How do you gain consensus around an issue, any issue?
Yeah, it's such a good question. And I think if you'd asked me this a couple of years ago, I would have answered it differently. The one thing that COVID taught me a lot of things, but one thing that it taught me is that consensus happens when we all center around human need. And during COVID, I co-chaired a cross-functional team, and it had all of those constituents you named, doctors and hospitals. We had on the team, we had nonprofit community organizations. We had labs, and we had all types of different players that were a part of the health ecosystem. And we came together around COVID, and our objective was, how can we reduce the impact of COVID on the state of Arizona? How can we help the people of Arizona deal with COVID? And when you've got that as your core, it's helping people. It was a really easy way to get consensus when you look at things through that lens. And so we worked together, and we did extraordinary things that I could have never thought those types of constituents could have gotten done together before. We got rid of bureaucracy around a lot of the rules, like pre-authorizations. We worked together to develop education campaigns around masking. We worked together to put together a map that we presented to the state to help them come up with guidelines for COVID. And so we're just working together with that common objective of the person in the center made all the difference in the world. And so I'm hoping, and I'm feeling that we can build on that, and we can bring about positive change together by just focusing on the individual, not focusing about reimbursement and policies, and just what's best for the individual. And I think if we can retain that learning from COVID, that will be a very positive thing. I'm bringing that forward, and I feel like others in Arizona that were part of that are also bringing that forward. So I'm hopeful.
Don't you think with COVID, because of COVID, we're seeing a lot more collaboration in healthcare, which is an amazing path forward. It's so important, right? But
So
I am also very hopeful that we continue to collaborate and do more of it in the future.
absolutely, yeah. So that's the silver lining. Let's just hope we don't forget that good part of it, that when we can bring that forward.
Absolutely. So in addition to stressing the importance of collaboration, you advocate that your teams should practice curiosity and lifelong learning. How do you keep your own skills sharp? And how do you stay abreast of trends, what's going on, with so many other responsibilities that you have as the leader of the Hospital of Arizona?
Well, yeah, it's a really interesting question because it has to be a little bit deliberate, I think. So every single morning, Fawn, I wake up at 5:30 and I get on my darn Peloton. And so I just start the day with just kind of an opportunity to be physically active and clear my head. And then and I think that's just a really good foundation for me to kind of get going. But in terms of staying current and being curious, and I know you do this too. I read massive amounts of material. I probably, on average, I read like 2.5, 3 hours a day. I read a lot. I read your magazine. I read. There's so much literature in our space now. I remember when I first started in health insurance, I used to get a list of clippings. Of course, it was manual. It wasn't electronic, but it would be every month I get clippings from that were relevant to our industry. And it was maybe 2 pages every month. It was just, there was nothing. Now there's just lots of information and lots of stuff to keep up on. So I read all the time. And I think that the other thing that is really critical is listening. And I am very deliberate in listening, not only internally to my own team and our employees, but externally, listening to our customers, what they're saying, what they need, what they say about us, what they say about other things, listening to providers, what kind of challenges they have, listening to brokers, listening to regulators, listening to consultants. So it's a lot of listening, and if you do that, and you don't really are again, I keep using the same word, deliberate, but I think you have to be deliberate about it. And you actually do something with that information in terms of the decisions that you make. I think your company benefits greatly. So that curiosity really can feed success in any organization.
Yes, I agree. Curiosity is one of the most important traits. If you're not curious, how do you gain new knowledge, right? How do you how do you learn?
Exactly. Yeah.
So anyway, I understand that you're spearheading a new initiative called Foundation for Community Health and Advancement, which focuses on impacting health in several areas, including substance abuse disorder, mental health, chronic health, and health equity. Those are all very complex areas. What does success look like for you, and how will you measure your progress?
Yeah, those are all very complex issues, and there is no silver bullet. There's no fast, easy solution. So it's really going to take a lot of different constituents and parties to affect change. We looked at Arizona and the challenges that Arizona had relative to the rest of the nation, and those areas that you called out. The whole nation doesn't do good, but we do worse than average here in Arizona. So that's why we pick those to focus on. The foundation, the Blue Cross Blue Shield of Arizona Foundation, it's what I call a non-operating foundation. We obviously operate, but we don't run our own programs, but we actually provide funding to grantees that then make a measurable impact through programs that they administer. And so we accept grants every year, and we look at the proposals, and we sit down and we make sure that there are going to be measurable results that are associated with that grant. And then we monitor it, and we watch the progress. But one of the reasons that I took this role 4 years ago was that I could be in a role where I could have an impact like this on the community. And one of the things, when you talk about measuring impact, one of the things that I implemented when I first got here was a bonus program that every single employee in Blue Cross Blue Shield of Arizona is eligible for, and it's tied to community health. So each year we pick a specific health target, a specific area that Arizona struggles with. And if we make progress against that target, every employee gets the bonus. If we don't, they don't get the bonus. So last year, our target, our metric was to reduce the death trend of opioid overdoses in the state of Arizona, which is a problem for us. Mm-hmm. This year, our goal is to reduce the trend for suicides per 100,000 here in Arizona. And so you've got all, 2,600 of our employees mobilized around these goals that really can make a difference in the community. We also allow them 8 hours of paid volunteer time every year. And so, we're out there in the community really focused on these things, and we measure it. We get the data, we track it. If we improve it, if we hit our set target, everybody gets rewarded for that.
That is awesome. And how do you communicate? Do you communicate your progress on an ongoing basis? And how does that work?
We do, is to the best of our ability. Data is kind of not our friend here. It's hard to get current data. So for instance, for the opioid overdose, mm-hmm. we had to work with the state of Arizona to get, they changed their process in terms of how they were recording and managing the data to make it more timely. So a lot of it, all this data lags. So we do provide regular updates throughout the year, but data is always a problem.
Yeah. So I'm sorry, I love the program, and I'm so curious.
Thank you.
Is there a certain percentage of the employee base that you're hoping to engage with the goal, with whatever that goal is for the year?
Yes. Well, we the way we measure it is, number one, if we hit the goal, everybody gets the bonus.
Right.
But we also track who's volunteering. So we have 78% of our employees that get out in the community.
Awesome.
And actually volunteer. So we track it that way.
That is awesome. Congratulations.
Thank
so
you.
This year is to lower the suicide rate, which
yes.
is an amazing, that's a very important area
yes.
that we all need to be paying close attention to.
I agree.
So with all that's going on, what keeps you up at night, Pam?
A lot of things that, there's clearly the current events that are worrisome, but from a work perspective, I worry about cyber. I worry about cyber and protecting data and making sure that we are good stewards of the personal information that we have on our members. I think that the thing that I probably spend most of my time on and feel like worries me the most is affordability. And you know the statistics, Fawn. People they can't afford their prescription drugs. Say 25% can't afford 25% of people actually delay healthcare. They don't get it because they can't afford it. People are cutting pills in half, and it's very worrisome to me that those kind of decisions have to take place. So we have a concerted effort to try and really impact affordability in a positive way. But that one I worry about, that we're just not going to be able to rein in like we really need to.
Thank you for sharing. Pam, thank you so much for talking with me today. And it's been a pleasure and an honor to have you as our guest for this episode of Fridays with Fawn.
It has been such a pleasurable experience for me, and lovely to see you, Fawn. And thanks for having me.
Thank you. And thank you, everyone, for joining us today. As always, I look forward to seeing you at the next Fridays with Fawn. Please don't forget to mark your calendars for the 2022 Modern Healthcare's Women Leaders in Healthcare Conference. Till next time, thank you. Bye-bye.